Hello, everyone. Hopefully you're able to hear me. Welcome to tonight's event. We'll get started here just in a moment or two. But I want to welcome everyone. We'll be going through Medicare here tonight. My name is Lucas Marty. I'm one of the financial advisors here with WDS. Before we get started, if everyone could try to update their Zoom name to their first and last name, just so that way we can get everyone checked in to make sure that everyone that is here can get any information that we need as a follow-up. If you're not able to update your name, if you want to message one of the co-hosts, whether it's myself, Kelly Nelson, somebody here, we can get you updated on that side as well. But as we get started here, like I said, my name is Lucas Marty. I'm a financial advisor. I've been with WDS here about June will be my 11th year. And tonight, like I said, we'll be going through Medicare with our newest member, Ben Rothering. At WDS, we focus on trying to help our clients achieve their family, financial, charitable, social, and health objectives, kind of one conversation at a time. So what we'll be focusing on tonight is the health side of things with Medicare. Like I said, Ben joined us here just recently as part of our newly established division of WDS Health. So I'll let him introduce himself. What we'll go through here tonight, about 45 minutes of information. There'll be a quick Q&A session, as well as we'll talk a bit about our events here for the rest of the year as well. But without further ado, I'll pass it over to Ben for the Medicare presentation.
Great. Can everybody hear me? Awesome. Well, thank you so much for joining us this Tuesday evening. I really appreciate you spending a little time. Hopefully we can get you a little bit of information, answer some of these questions as many of you are potentially approaching this Medicare process. So I'm going to share my screen here. Here we go. All right, so everybody should be able to see my screen here. So take down my information, my email, my phone number. If at any point in time you have questions, don't hesitate to email me, call me, text me, whatever works. I'm more than happy to help at any given time. But a little background on me, how I got here. I am originally from the Madison area, born and raised, the product of a high school history teacher and a cancer nurse for about 40 years. And I actually went to school to be a school teacher. I was a physical education teacher for a number of years. I taught here in the Madison area at all different levels, and realized that I didn't see myself being a teacher for 40 years, kind of like my dad, and thought I'd look for something else. And to be completely honest, insurance wasn't really on my radar, being a FIED teacher. But I met a pretty good guy that started in this business late in his 60s and said it was the best job he's ever had. So I thought I'd check it out. And here I am. I've been doing this for about 8 years and just recently started with WDS to create this WDS Health division and see if we can help all of you and all of the WDS clients and with this process of Medicare. So I hope you find this helpful. It is purely an educational PowerPoint and presentation here. And so we're not going to talk about product or anything. We're really just trying to get your feet wet as far as what is Medicare, what are all the different parts. Before I get going, you will see that you're gonna see a lot of Physicians Mutual. This presentation is with Physicians Mutual. It's a company I've been with for all 8 years. I am also contracted with a number of other companies, whether it's with supplements or Advantage plans. So all really the major players that are in and out of our area. Thing is all these materials and presentations have to be approved through the state, and this is one I've used for a long time. It's a great presentation. It's very easy to use, very easy to follow, and I'm obviously most comfortable with it. So that's why you are seeing Physicians Mutual on these slides. Not a way to push you in one way or another. It's just a great presentation. So without further ado, we'll get going. My hope is that all the questions that you have, that I'll be able to answer them throughout. And then at the end, if you have any questions or if we need to go through anything and get a little bit more clarity, we can certainly take those questions at the end. But on a day in and day out basis, this is what I do for a living, helping people with their health, life, and retirement. Under the scope of health is, obviously with supplements. Advantage plans are part of that as well. Part D, prescription drug coverage, dental and health or dental and vision coverage. A lot of people coming off their group coverage, they want to be able to continue that dental and vision coverage. So I can help with that as well as extended cancer protection, life and retirement. And obviously you guys are with a great program here, great company with WDS who definitely takes very good care of you. So a little bit about Physicians Mutual, again, just because this is their presentation. They've been around a long time. They're working their way through their second pandemic here, and they've been helping people with their Medicare supplement needs since Medicare started. And it is their only major medical product. They don't cover anybody who is quote unquote under the age of Medicare or in the marketplace. They are a mutual company and they've got a great rating to follow. So some of the questions that you may have, transitioning, how do you go from being an employee to a retiree? How do you enroll in Medicare, all the different parts, and then paying for healthcare when you are in your retirement year. So let's talk basics here. Medicare, it is a federally funded program. We've all been paying into it with our taxes all our lives. It is typically for people that are getting ready to turn 65 or beyond. It can be for people under the age of 65 if you health qualify. If you have a disability that qualifies you, or if you have permanent kidney failure, you can jump onto Medicare early. Not to be confused with Medicaid, which is federally and state funded, typically going to be for people with limited resources. So Medicare, it started in 1965, run by CMS, which is Center for Medicare and Medicaid Services. Again, typically for seniors. And over the years, they tried to enhance Medicare a little bit by adding prescription drug coverage, by enhancing their preventive care. And there are definitely some other resources that are out there that can help you get some more information and make different choices along the way. So some other questions you may have, your eligibility. When are you eligible? What about Social Security and Medicare? A lot of people will get these two things mixed up, and it's understandable. Medicare, taking that health insurance and taking your Social Security benefit, those are two separate things. Where people get them confused is we have to go through Social Security to enroll in Medicare, okay? And I can help you with that as well. What about retiring early, or if you work beyond 65? All these questions you may have. What if there's a spouse in the mix? What do we do in those cases? So we'll try to tackle all those questions and hopefully answer everything for you today. One thing that I would certainly do, and everybody here, you're on a webinar, so we have some level of comfort with technology. But if you don't already have a My Social Security account, I would highly recommend getting one. It will make things easier, obviously, with your financial advisors here. That can certainly help figure out what your Social Security benefits are going to be. But it's also a really easy way to be able to enroll in Medicare without necessarily having to go down to the office and wait in line or wait for a phone call or set up a meeting that's going to be, a month and a half to 2 months down the road. So getting that account is really important and can certainly make your life a lot easier. So what should you do? Well, it's a good question. If you're working and you're receiving health insurance, whether it's you or a spouse and you have employer coverage, one thing I would absolutely do is check with the HR department within that company. That's always a good route to start, making sure that we are following what they want, okay? More often than not, what's going to happen is if you have group insurance, but the company is maybe a smaller company, say 20 employees or less, more often than not, what they'll want you to do is take out Medicare, Parts A and B, and what's going to happen is that will serve as your primary, and then the group insurance through the smaller company will serve as secondary. If you're with a larger company, again, more often than not, what's going to happen is take out Part A. You've been paying into it all your life, so that will end up being premium free. but don't take Part B right away because you're going to pay a premium for that. And with a larger company, greater than 20 employees, they're offering that health insurance potentially, and they're paying a portion of that health insurance and you're paying the other portion. So there's really no sense in paying for Part B and your group coverage when Part B is going to be sitting in a secondary position. So you'd want, an opportunity to save your money that way. What is important to know though is, right now when you're on this group coverage, we're also used to these family plans, right? Everybody's under that same plan, that same umbrella. But when you go on to Medicare, that all gets stretched out. Everybody has their own, right? You're going to have your own A and B or C, your own drug plan, your own supplement, whatever it happens to be. Your spouse is going to have the same thing. They're going to have all their own. There's no family plan when it comes to Medicare. So enrolling. Okay, so before I get into this slide, I really want to create two separate groups. Okay, group number one is going to be the group who is not yet drawing on their Social Security benefit. Group number two, you already are drawing on your Social Security benefit. Okay, so if you're in group one, not getting your Social Security benefit and you plan on enrolling in Medicare, you have to do that, right? That is something that you have to go on and do. And you can just take out Part A depending on your employment situation, or you can do A and B to start. If you are someone who is drawing on your Social Security benefit, the government knows you're turning 65. Okay, so you will automatically be enrolled in Medicare Parts A and B, and you'll get your card roughly 3 months ahead of your birth month. Okay, and it is your job to read that card and say, if you still have that large employer group coverage and you don't need Part B, then you flip it over, you send it back, and they'll send you a new card with just Part A on it. Now, as far as Part A goes, for most people, this is going to be premium free, whether you or a spouse, you worked long enough, right? 40 quarters, 10 years or more, then Part A should be premium free for you and you shouldn't have to worry about any penalties or anything like that. Okay. Now, everybody is going to fall into one of these three enrollment periods. Okay. The first one is the initial enrollment period. This enrollment period is when you are approaching age 65. It's a 7-month window, starts 3 months ahead of time. It includes your birth month and then 3 months after. If you are planning on going on Medicare when you turn 65, I cannot stress enough how important it is to use the 3 months ahead of time. It will make your life a lot easier. Doesn't mean we can't get you Medicare and get you all set up, but if you go to the 3 months after, it just complicates things a little bit. So definitely use that time frame that they're giving you ahead of time. Medicare will begin on the first day of your birth month. Even if you were born on the 30th of a month, it'll still begin on the first day of your birth month. The only difference would be if your birthday is actually on the first of a month, you get to start a month ahead of time. Okay. I'm going to pass over the general enrollment period for just a moment because the next enrollment period that's most common other than the initial would be the special enrollment period. So the special enrollment period is when you turn 65, you don't take out Medicare Part B or any part of Medicare potentially, but if you don't take out Part B because you still have that group insurance, then down the road, few years, now you're going to retire and your group insurance is going to end. Now you can pick up Part B, you can pick up a supplement or an advantage plan, your drug plan, any of that. And this is called a qualifying event. So you can pick up all those things without having to worry about getting a penalty. Okay, so don't let anybody call you and scare you about, hey, if you don't do this now, it's going to be a penalty and this and that. As long as you know that you have that creditable coverage through an employer, you'll be just fine. And now that window, that special enrollment window, it's not 7 months long. It's actually 63 days long from the date that your coverage ends. Okay. Now, with that being said, we can still get things set up 3 months before that. So we can have it all ready to go so that the day your group coverage ends, everything else will start and your coverage will be seamless. Now, the general enrollment period. This is when you turn 65 You have no health insurance. You don't pick up Medicare. You have nothing through an employer, and you continue on. And now you've gotten outside of your initial enrollment period. And now you're thinking to yourself, well, now maybe I should pick up Medicare. Well, now you're going to enter into what's called the general enrollment period. And what that is you have to wait until January to enroll in Medicare, and then your coverage will start the first of the next month. Now, this is a rule that just changed this year. Previously, if you were part of the general enrollment period, you'd have to sign up during this time frame, but your coverage still wouldn't start until July. Now they changed it so it'll actually start the next month. So if you sign up in January, it'll start in February and March, and so on. Hopefully, we don't fall into that general enrollment period, because that is where you will receive a penalty for not picking up not picking up Medicare when you should have. Okay, so hopefully everybody falls into either the initial or the special enrollment periods. Then we won't have to worry about those penalties. As I mentioned previously, that if you are drawing Social Security, you're automatically going to be enrolled. So you got to flip that card over if you don't need it, if you have continued group coverage through your own employment or a spouse's. And we kind of talked about these. I went through them, but we're going to skip through this. Now, everybody will have a premium for Part B. Okay. What they do is they're going to look at how you file your taxes from 2 years prior. So right now they're looking at 2021. Did you file individually or did you file jointly? What bracket are you in? And then the bottom row will tell you what you can expect your monthly premium to be. Now, with that being said, let's go back to our groups, Group 1 and Group 2 of not drawing Social Security and drawing Social Security. So how do you pay your Part B premium? Well, if you're in Group 1 and you're not getting your benefits yet, they are going to start out by billing you quarterly. If you are drawing Social Security, they will draw that out of your account before they deposit it or deposit your benefit check. Okay, so that will be a monthly thing that they will do for you. This will change from year to year. It can. Obviously, the government knows. They look at your taxes and they'll send you a letter. This is what your Part B premium will be for the next year. If you find that you are in a higher bracket than you're expecting, that in that letter they send you, there are instructions on how to appeal. And if you had some sort of a windfall, whether you sold a business or property or something like that, we can certainly try to appeal. And I know WDS has done a really good job with helping with that. All right, let's get into the alphabet soup of Medicare. All right, A, B, C, and D. So parts A and B together are known as original Medicare. This is your hospital and your medical. Part C is Medicare Advantage. This is privatized Medicare. Okay, if you have A and B, you don't need C, but you need to start with A and B in order to get C. Part D is prescription drug coverage. So I'm going to break these up and talk about each of them individually. And as we go through this, we are slowly going to fill in this healthcare pie. Okay, so these are all the potential gaps in coverage that you could see as you go through your retirement years. And we want to see how is Medicare going to help fill this in and what gaps might still be left there that we got to make sure that you have coverage for. So Part A, we'll start with that. Part A is all about your inpatient or hospitalization. Okay, when you are admitted to the hospital, and I stress the word admitted because there's a significant difference between admittance and observation. Okay, I'm going to discuss that shortly here. Now, Part A works all on a 60-day benefit period. Okay, so if you are admitted to the hospital, that initiates that 60-day benefit period. And Medicare is going to cover everything within those 60 days after the Part A deductible has been paid. And that Part A deductible for this year is $1,600. So once that's paid, now Medicare's got the rest of those 60 days. If you remain in the hospital beyond, you can see that there are daily hospital copays that would be left over. When you get to days 91 through 150, those 60 days are called lifetime reserve days. They are one-time use days. So what that means is if you're in the hospital for, say, 95 days, you've used 5 of those lifetime reserve days and you're down to 55 for the rest of your life. What the most important part of this slide, though, really what I want you to get out of this is that those first 60 days, that's a benefit period. So they can start every 60 days potentially, right? So if you were admitted to the hospital and then you're discharged and you get outside of 60 days and now you're admitted again, that whole new 60-day benefit period starts all over and another $1,600 needs to be paid. So over the years, I've had people ask me, hey, if I have Medicare, and you've ever seen a bill, a medical bill with Medicare on it, they significantly reduce a lot of these medical costs. And people ask, well, if I have Medicare and they cover a lot of the, they knock it down a lot and they cover most of it, do I need anything else? Well, and the answer to that is legally, no, you don't have to. But let's say you have a rough year health-wise where you are admitted to the hospital 4, 5, 6 times a year. Most people don't want to pay that $1,600 4, 5, 6 times a year. They want to pick something up that's going to help give them a cap, right? Because Medicare, it's an uncapped liability. So that tab is just going to keep on rolling, okay? Now, if you know that upon being discharged from the hospital, that you have to go into some rehab, you got to go into a skilled nursing facility, we have to make sure that we follow Medicare's rules, right? When you go on Medicare, they make all the rules and requirements. They are your primary, okay? So in order for Medicare to follow you to a skilled nursing facility and to cover those first 20 days, this works on a 20-day benefit period, you have to have been admitted to the hospital for a minimum of 3 days, 3 midnights actually, and you have to make sure you're always at a Medicare approved facility. That's something you should always make sure you're at, right? You have to make sure that you are at a Medicare approved facility. Otherwise, you count yourself basically uninsured, okay? So as long as we follow Medicare's rules, they'll pick up the first 20 days at a skilled nursing facility. They leave a little bit behind from days 21 to 100. But again, that's a benefit period of 20 days that can start over. The important thing here, and kind of the horror story that goes along with this, is to make sure that you were admitted for those 3 midnights, okay? If you were only under observation and now you're going to a skilled nursing facility, Medicare will not follow you, okay? You could be under observation and spend a few days in the hospital and technically not be admitted, okay? Part B is going to be helping you out when you're in the hospital under observation. But if you leave and you go into skilled nursing and you weren't admitted for 3 midnights, you are now uninsured. Medicare will not follow you and no other product can. Okay, we got to make sure Medicare is there. So how do you know that, right? If you're going through a major medical event, who's going to be thinking about these things? All right, well, that's where I tell my clients to call me, email me, text me. Let me help you, right? We're going to go through this tonight. It's going to be less than an hour. You're not going to memorize all this stuff, but that's why you have me. I want to be your first line of customer service to make sure that Medicare is always going to be following you, okay? I'll give you a story. A couple of years ago, I had a client email me on a Friday, and he says, Ben, I've been in the hospital since Monday, and, here now they're telling me I got to go into a skilled nursing facility. I don't have my insurance policy with me. Can you review the rules? Absolutely, right? Because you're going through a major medical event, you got an ambulance coming to pick you up. You're not going to say, hey, will you stop chest compressions real quick? I got to get my insurance policy to make sure I'm following all the rules, right? So it's not feasible. It's not going to happen. So if you have questions, certainly reach out, let me know, have your loved ones, your friends, whoever's with you, reach out so that we can make sure that you are covered, okay? And then to finish up with Part A benefits, blood work. This would be like inpatient transfusions. Medicare doesn't cover the first 3 pints, but they cover everything after that each year. Home health care for anything that is considered medically necessary. You're going to see that a lot. Medical necessity, right? We can't just go and do anything we want whenever we want unless we're willing to pay for it, okay? We have to make sure that what we're doing, any tests, procedures, and whatnot, that our doctor is proving to Medicare that is medically necessary to make sure Medicare continues to be on board, okay? And then hospice. This is a great benefit. So as I mentioned previously, my mom was a cancer nurse at UW Hospital for about 40 years. My wife is a nurse as well. She has her master's in end of life care and dementia, and was a hospice nurse for a number of years. And this is really kind of the gold standard benefit. All the medical care that relates to a terminal diagnosis is really pretty well taken care of. Any potential for out-of-pocket costs when it comes to hospice would be if you are, again, you have to be deemed terminal, but if you have a prescription med that has no part of that terminal diagnosis, there's potential that you would have a copay that goes onto your drug plan, right? Another potential out-of-pocket would be, if you are deemed terminal, but you're living at home and you have a nurse coming to visit you, all that medical care is taken care of, okay? But if you are living at a facility, let's take a Grace. If you are a resident at a facility, there's potential that you would end up having to pay the rent or the room and board to live at that facility, but the medical care is still taken care of, okay? So that rounds out all the Part A benefits. And that's how it's going to help out, start filling this healthcare pie in. Okay, so let's jump into Part B and see where we go from there. So Part B, again, this is all about your outpatient. It's your regular doctoring, your specialist visits, therapies, durable medical equipment, ambulance services, preventive care. Okay, it's your inpatient, outpatient doctor services. That's if you are under observation in the hospital. Now, when you start Part B, you have 12 months to do what's called a Welcome to Medicare visit, okay? And every year after that, Medicare is going to pick up an annual wellness visit. It is important to know that neither of these is a true full-on physical evaluation, okay? It's a check-in with your doctor, it's a questionnaire, memorize 3 to 5 words for a memory test, renew your meds, you're in and out in probably 30 minutes or so, give or take, okay? But you get to check in with your doctor and go through any questions or any new things that are coming up. Medicare Part B does include some preventive services. These are just a handful of them, but there's a list of them. But these are the ones that a lot of people talk about the most or most familiar with. So flu shots, we'll start at the bottom. Medicare will pick up a flu shot every year. My recommendation is any vaccine you're looking to get it at a pharmacy. It'll make your life easier so that you don't end up getting charged for the administration of a shot from the nurse if you get it at a doctor's office, okay? Get it at a pharmacy. They will bill your Medicare Part B. They'll bill your drug plan and all that. So that'll make things a lot easier for you and take out, an extra step that you'll have to do. Colonoscopies. Medicare is going to pick up every 10 years. Now, some of you might be thinking, well, hey, I had a colonoscopy and my doctor found some polyps and now they said I have to be more of a frequent flyer, right? I got to come in every 5 years, every 3 years, or whatever it might be. Again, we go back to medical necessity. So as long as your doctor says, yes, it is medically necessary, this is a high risk person, we need to check them out more often, then Medicare will be on board more often. Same thing with like blood tests or mammograms. Right? Medicare will pick up a mammogram, whether it's a traditional mammogram or a 3D mammogram, once a year. Okay. Now, Part B works a little bit different than Part A. If you remember, Part A had that 60-day benefit period. Part B works on more of an annual deductible. This year, the Part B annual deductible is $226. Great news, that went down from last year. Last year it was $233. So before Medicare is going to jump in and pay their 80%, which most people are pretty used to, or they understand Medicare is in for 80% and they leave out 20, right? But before Medicare jumps in for 80, that 226 needs to be picked up, okay? And then for the rest of the year, now it's 80-20 as long as Medicare is on board. Medicare is going to pick up any clinical lab services for blood tests, diagnostics. We talked a little bit about preventive care, but nothing that exceeds the Medicare approved amount. So what does that mean? So Medicare has their idea of what they think is an appropriate charge for every particular procedure, right? Basically, they're going to discount it. And as long as you are at a facility that accepts and bills Medicare and you have a doctor that accepts Medicare's assignment, okay, accepting assignment, then Medicare will pick up 80%, right? And they leave 20% behind. But what is an excess charge? An excess charge is the difference between the Medicare approved amount and the actual amount being charged. So let me give you an example. Now, remember, I was a Phi Ed teacher, so I'm going to use a really non-realistic example, but easy numbers. All right, so let's say you go to the doctor and the total bill is $115. And Medicare looks at it and they say, well, we approve $100 of that $115. Okay, as long as the doctor accepts assignment, they say, okay, forget the 15, we'll take the 100. Medicare covers their 80%, and there's the 20% that's left over. If the doctor does not accept Medicare's assignment, they can actually charge 15% more than that Medicare approved amount. That difference is the excess charge. Okay. What is Medicare Part B not going to cover? Well, they're not going to do anything with routine dental, very little with routine vision, hearing. They're not going to pay for foot care, orthotics, or anything long-term care. Nothing alternative. Everything that Medicare is on board with was already put through its paces and approved, right? So if you're looking more into holistic style approach to your healthcare, that's going to be an out-of-pocket expense. Nothing elective, personal care, they don't leave the United States. Prescription drug coverage, we're going to talk about that shortly. Nothing non-medical. So what are examples of that? Well, if you, let's say you have some diagnosis and you want to get a second opinion and you're going to travel halfway across the country to go see a specialist, right? They're not going to help cover any travel costs, lodging costs. If you're going through treatments and maybe, you know, you lose your hair and you want a wig, they're not going to cover that, okay? So this is how Part B, oh, there we go. This is how Part B is going to help fill in some of those gaps. So you'll notice there's still quite a bit of white here, a lot of gaps left behind, all right? All right, so we've covered A and B. Let's talk Part C. Part C is Medicare Advantage, okay? This is privatized Medicare. So as I mentioned previously, in order to get an Advantage plan, you got to start out with A and B. You have to enroll in A and B. But then if you decide to go with an Advantage plan, now what it does is it replaces A and B. And now you have a private insurance company that made their own special agreement with Medicare, and now they're taking over. Okay, they are the ones that are now in charge. They are your primary. Okay, now what happens with that? Well, if you go with an Advantage plan now, because you have a private insurer that is your primary, now it's typically going to come with network restrictions. You're going to have HMOs, you're going to have PPOs, right? Kind of like you're used to with group coverage, where you have that network of doctors that you have to be a part of. And if you want to leave that network for, say, a second opinion, then you have to get prior authorization, right? You have to get a referral, okay, to leave that network. Those networks can change from year to year. They work in counties, okay? So your county or these groups of counties might be a part of it this year, and then next year they might reduce it or expand it to include more or reduce how many counties that are a part of that network. Advantage plans are called optionally renewable every year. Okay, so what that means is that every year, every private insurance company that is going to offer an Advantage plan, they have to renew their agreement with Medicare. And if they don't, then it can cancel, right? It can go away. They might not offer it the next year. If that happens, you will have the opportunity to go get anything else that you want, right? If a plan cancels on you, then you enter into a new special enrollment period, no matter what your health is like, and nobody can ask you a single question. If a plan cancels on you, you can go get anything you need, okay? With Advantage plans, out-of-pocket costs can change over time, so their outline of coverage, they can change their copays for visits to, primary doctors, to specialists, for hospital visits, stuff like that. Those, their max out-of-pocket can change from year to year. And you can't pick up a supplement to pick up any of those additional costs, okay? So how does that compare to, say, having A and B and having a supplement. Okay. And all of this that you are seeing here, if you pick up the guide to Medicare that the Office of the Commissioner of Insurance puts out, you will see all of these things within that booklet. That's something that we can certainly get to you. The commissioner, we can have one ordered for you or whatever, but they will tell you the differences between all these different types of plans, like a supplement or a Medigap plan versus an Advantage plan. So if we run right back down this list, if you decide to go more with a supplement, then you'll have A and B as your primary, and Medicare is your primary, and then your supplement is secondary to Medicare. Okay, so it'll allow you, it's not private anymore. Now it's the federal government who is providing you that insurance. Where Advantage plans will normally come with network restrictions, having A and B in a supplement, your network is wherever Medicare goes. Okay, so within the country, as long as you're at a Medicare approved facility, every supplement that is out there will travel wherever Medicare goes. So the analogy that I use is kind of like a tractor and trailer approach, right? So Medicare A and B, that is your tractor. And as long as it's pulling your supplement, your trailer, then it'll go anywhere, okay? Where Advantage plans say that they're optionally renewable every year, right? They have to renew their agreement with Medicare. A supplement or a Medigap plan is what's called guaranteed renewable for life. So what that means is as long as you pay your monthly premium, that plan cannot change, okay? You will have it. Hey, let me back up. You will have that plan forever as long as you pay your premium. Premiums can change. Premiums are going to change with everything. Unfortunately, insurance products, they're inflationary, right? However, the outline of coverage within your supplemental plan does not change. Okay, how it works with Medicare Parts A and B, that does not change unless you change it. And obviously you'd have a supplement, so we don't have to worry about that. So that's a little bit of the differences between Advantage plans and supplemental plans or Medigap plans. Okay, there is a plan for everybody. Everybody has their own situation, whether, with your health, whether you've got chronic health issues or if you're relatively healthy, financially, everybody has a different story as well. And my goal is to really fit you to a plan that is going to, help you both medically and financially. Okay. All right. So we've talked about A, B, C. Let's go into D. Part D is all about prescription drug coverage. Okay. There are 23 different drug plans being offered in the state of Wisconsin this year. That changes from year to year. Reviewing your drug plan, I cannot stress enough how important it is to do every single year. Okay, during open enrollment, it's October 15th to December 7th. It's a time frame I affectionately call drug season. That is a time when we get to see all the different drug plans that are being offered for the next year, how their premiums change, how their deductibles change. Did they change their coverage on every individual med? Did they change pharmacies that are in network or out of network? All those things change every single year, okay? And it is so important to review this. I can't stress enough because the smallest change could mean a really large change in your pocketbook, okay? I'll give you a very extreme but very accurate example. This happened a couple of years ago. I have husband and wife clients. They live out in the kind of the middle of nowhere, and they only really have two close pharmacy options. And we were reviewing her meds and her plan for the next year. And if she would have stayed on that plan, the one that she was on, if she stayed on it for the next year, she was looking at an estimated out-of-pocket of over $40,000. This is the biggest one I've ever seen. And I could almost hear the tears hitting the floor through the phone. That's terrifying. How do people pay for things like that? Most people can't. And so what we did, we take a look at her drug plan. We take a look at the pharmacies that are being offered. And we noticed that some of her meds had been dropped from the plan that she was on for the next year. So we found her a new plan. We switched pharmacies and we got her estimated out of pocket to under $500 for the year. Okay, not an exaggeration. That's just what can happen, right? Usually there's a couple a year that are, a big difference. More often than not, it might be a couple $100 here and there, maybe a couple thousand, but every once in a while you get one where it's just an extreme example like that. So it's just that important to check it out. Sometimes there's no change that needs to be made. It's a 5-10 minute phone conversation. Don't do anything, let it roll into next year and we're done for the next year, okay? But if we can catch those changes and make sure that it doesn't affect you and your pocketbook, that's the goal, is to save you as much money as possible. So again, with A and B and Medicare being an uncapped liability, there's no yearly limit for what you could pay out of pocket, right? And what can you do? Well, you could just stick with A and B, or you could keep that A and B and then pick up a Medigap or a supplement plan to help give you that cap that you're looking for. If you do that, you will need to pick up a standalone drug plan, all things that I can help with. If you decide to go with Part C, privatized Medicare, with a Medicare Advantage plan, some Advantage plans will include drug coverage, but not all of them. So depending on the plan you find, if you like one that doesn't have drug coverage, then we'll have to find a standalone plan for it, okay? But everybody's a little bit different. We need to figure out what your needs are and make sure that we kind of mold a plan to you and fit it to you and your medical and your financial needs. Other things that we're going to want to talk about and stuff that I can help you with is the company that you're going to be hooked up with, right? We want to know about them. Are they a credible company? Do they pay their bills in a timely manner? Are they financially stable? What kind of rate options do they provide you? What kind of products are out there and what do they do that potentially goes beyond Medicare? Okay. It is important to know that with supplemental plans in the state, they all start the same because they're standardized. That does not mean that every supplemental plan is the same. It means they start the same. But then every company tries to differentiate themselves, whether they offer you a health club membership or offer you enhanced preventive care. Premiums obviously are going to be a part of that as well. All things that I can help kind of figure out with you and show you all the differences, and whichever plan you feel is going to be the best for you and you're the most comfortable with, well, then that's what we do. Okay. So with that being said, again, here is all of my information. Please feel free to take it down. Feel free to contact me with any questions. And now let's see, how do we do? 45 minutes. Amazing. Oh, sorry, my watch was talking to me. So why don't we open it up to questions?
Ben, there are some questions that were posted in the chat. Can
I
you
will
see
take a
them,
look.
or would you like me to read them?
No, I've got them here. Let's see. Let me go back to the top here. Are there certain inpatient procedures that allow for an exemption of the 3-day minimum stay for SNF coverage, like a knee replacement? If you go with original Medicare, A and B in a supplement, I wouldn't count on it. Sometimes Advantage plans might kind of skip through that a little bit, but I wouldn't count on it. So how do you get around that? You can certainly talk with your nurse. I would bring in a social worker and let them know, have those conversations. You definitely have to be an advocate for yourself, and ask those questions and say, hey, I'm on Medicare, and whatever is being done, wherever you're sending me, we need to make sure that Medicare is a part of it. Okay. And again, if you have questions, you can certainly contact me and I'll do anything that I can to help out. I promise you, I am not someone who is going to make up answers. because that doesn't help you, and it's, I could lose my license. So if I don't know the answer, I'll do my best to help either direct you or find the answer for you. In my experience to this point, I haven't seen any exceptions. That doesn't necessarily mean that there wouldn't be, but I wouldn't count on it. If my Advantage plan cancels back on me, can I go back to Medicare A and B, or do I have to select another Advantage plan? It's a great question. If anytime any plan cancels on you, you can go get anything you want. So the answer would be yes, you could go back on A and B, and you could go pick up a supplement. Absolutely. Okay. As far as being able to move back and forth between all these different things, okay, again, if it cancels, you can do anything. Advantage plans and supplements work a little bit different, okay? Advantage plans are kind of like drug plans, where at the end of every year, you can switch to a different one, no questions asked. Supplements, when you pick a supplement, typically the analogy that I use is this. If you're going to go with a supplement, find one that you can marry, one that is going to take good care of you the rest of your life. Where when you're looking for a drug plan, find one that you can date, right? You're going to date it for the year, and at the end of the year, we're going to see if the grass is greener, okay? If you decide that you don't like the company or the supplement that you're on and you want to switch to a different company, then you can do that at any point in time throughout the year, but you have to health qualify. So that's why using your initial or special enrollment periods is a really, really important time, because that is your opportunity to go get the pick of the litter, the very best, no matter what's going on health-wise. Nobody can ask you a single health question, okay? Down the road, if you decide you want to switch, your health is the only thing that is going to allow you to switch and purchase your next policy, okay? Let's see, could Congress change Medicare supplement plans? Yeah, well, I mean, a new law came out a couple of years ago, effective January 1st of 2020. A new law took effect where they said supplemental plans can no longer, from that point on, offer a full-on 100% coverage plan where they pick up everything Medicare leaves behind. Typically, what's going to happen in situations like that, and with this particular law, anybody who was eligible for Medicare prior to that date, they're kind of grandfathered in. So if you were eligible for Medicare prior to 2020, but you decided to work longer, and now you're coming off of that group coverage, you can actually get some of those old quote unquote plans because you were eligible. Okay. So yeah, some changes can be made like that. Let's see. What are the rules for when you can move into or out of a Medicare Advantage plan, and are there limitations to your freedom to do so? So that's a great question. Advantage plans are the only plan where the government says, we're going to give you your first year. The first time you go on an Advantage plan, we're going to give you that first year as like a free look period. And during that first year, if you decide you want out and you want to go back to original Medicare and get a supplement, you can do that at any time, but it's got to be before you hit your year. If you stay on an Advantage plan for a year and now you're in a little bit longer and now you want to switch, now we have to wait until open enrollment. Okay, then you can get out. But if you want to, again, if you want to go to A and B, go back to original Medicare and then pick up a supplement, then you would have to health qualify to do so. Is it mandatory to purchase Part D? What if a person has no prescription medicine? Another great question. So, is it mandatory? No. Here's what the guidebook that the Commissioner of Insurance puts out, and here's what it says under Part D, that enrolling in a prescription drug plan is voluntary. But then the next sentence, it says, however, if you do this late outside of your enrollment period, then you're going to get a penalty of 1% per month on top of your base premium for the rest of your life, as long as you have Medicare. Okay. So is it mandatory? No. Drug plans right now, they range anywhere from $6.60 a month up to, I think, 113 or something. Okay. Now, if you're somebody who does not have any prescription drugs, okay, there's another alternative that I could certainly throw out there, and that would be what's called senior care. Okay. Senior Care Wisconsin is a state pharmaceutical assistance program. It is not necessarily that you need financial assistance for your meds. What it would do is serve as a placeholder as your creditable drug coverage, so that down the road, if you needed to pick up a drug plan, if your doctor puts you on meds X, Y, and Z, then you can do so without getting a penalty. So it's kind of parking in that spot so that down the road you don't get that penalty. So that's kind of your other option. Senior care is $30 annually. So it saves you a little bit of money, parks in that spot, saves you from getting a penalty down the road. Okay. How are my fees determined? I am straight commission. So I know there are some agents out there who will charge consult fees. I don't. To charge somebody $50 for a process that they have to go through, and for as confusing as most people feel that it is, yeah, I don't do that. So if you have questions, contact me. It's my job to make sure that you like me and that you want to work with a guy like me. But I am paid on commission, and every company is a little bit different. So when I say health qualify, does that mean that if you have chronic condition like cancer or heart disease, can the supplemental plan not insure you? Absolutely. They can just say no. They can just deny you. So let's say you start on a supplement with company A, but you want out and you want to go to company B, all right, and get a supplement over here. You have to answer their health questions and they have to accept you, right? If they do, great. If that's the case, we wouldn't cancel out on A yet. We would put in an application, make sure you're accepted with B, then cancel A, all right? Sometimes we have to go through different companies. If you're looking to make a switch, and some companies are a little bit more stringent in their health questions, others are a little bit more lenient. So, I've had clients where we went through 4 or 5 companies until we finally found one that would take them. So if that's the case, that's what we might have to do. But yes, absolutely. If you're outside of your enrollment period, they can deny you, for sure. Let's see. Ooh, I think I hit the end.
All right. Well, thank you, Ben. We do have a few more minutes for some more questions if anyone wants to get in. Put some in the chat. Otherwise, I'll take this opportunity to make a couple announcements on behalf of WDS. So I'm Jacob Marty. I'm a new advisor that just joined last year. So you'll be seeing a little bit more of me going forward. And we have a few more events coming up in the next few months that I'd like to share. So I'm going to share my screen. All right. So we have a couple of client events coming up. So in March, we're going to have March Madness. So we do this every year. We have an NCAA basketball contest. Jeff organizes this. So all are welcome to participate. So you can join as just a single person, or you get your friends and family to join as a team. So there'll be a link that comes out pretty soon in mid-March that will give you more information and sign up details to that. And then April is our big charity event for the year. So this year we're going to be in the charity night to benefit DAIS, which is, let me make sure I get this correct, the Domestic Abuse Intervention Services. And that'll be on April 28th. So you can sign up for that on our website. and get friends and family to join. The more the more the merrier. And then in May, we're going to have a Women in Wealth presentation by Kristen Ukema with T. Rowe Price. So that'll be a virtual event. So everyone's welcome to join that, not just women, but want to celebrate women for that. So other than that, I have one last thing. February, we do have one last thing going on, and that is the Best of Madison. So MadisonMagazine.com has a bunch of different categories for area businesses, organizations. And so WDS is trying to advocate for getting the best in wealth management for the area. So you can vote every single day. We would really appreciate any of the support and participation we get in this. So again, the website's right here, MadisonMagazine.com/BOM, Best of Madison. So go there, find the wealth management tab, and you could just put in our name and it'll click there. So let's see if we have, that's all my announcements. Let's see if we have any final questions for Ben. But thanks, Ben, for doing a great job. Clearly know your stuff. It's very helpful for everyone.
My pleasure. Yeah, there are a couple more questions, and then we can finish out so that everybody can get back to their evening. And again, take a look at take down my information, and if we're all done and you still have some more questions, obviously, typically what happens is when we turn it off, now questions start popping up again. So feel free to write them down, send me a message, and I'd be happy to help. So question, let's see here. Why would I choose a Medicare Advantage? Again, there's really a plan for everyone. A major sticking point for a lot of people is prescription drug coverage. And so we want to weigh the costs between getting, say, a supplement in a standalone plan versus getting maybe an Advantage plan that does include drug coverage. Advantage plans, a big difference between them, or kind of a basic difference is, with a supplement, you're going to pay a monthly premium and have maybe less out of pocket along the way, where an Advantage plan, you could have no monthly premium and save that, but then you have co-pays along the way. So it kind of depends on how you want your healthcare to go. But there's certainly a place for everybody and whatever your particular needs are. If you have a spouse that is younger than you have to sign up at the same time if they have insurance. So no, again, I would certainly talk with HR and just say, hey, I have a spouse that is getting ready to turn 65. They're going to be on Medicare. My guess is you would take out Part A, again, if it's a larger employer, but don't take out Part B because you're paying for part of that insurance. But talk with them, make sure that's what they want, and that we're following their rules. Okay. Are supplement and Advantage plans both able to deny for pre-existing conditions? So once you're out of all these enrollment periods, actually Advantage plans, to my knowledge, they don't health qualify. They'll take anybody and everybody. Absolutely. You're more than welcome. I appreciate you joining us, and hopefully it was super helpful and answered some questions. My opinion on excess coverage rider and home health care rider. How often does a doctor not accept assignment? Truly depends. So these riders, to be honest, they're really, really inexpensive. So I'm talking, in or around $1. So it's not a huge deal. So it might just be nice to have it just in case. As far as doctors accepting assignment, yeah, it's a great question to ask. If you say you want to go up to Mayo Clinic in Rochester, the facility accepts and bills Medicare, but not all the doctors accept assignment. So it's just a good question to ask to make sure that any potentials, right? And Medicare includes some home health. Again, same kind of answer as the excess, that rider. They're just really, really inexpensive. So if Medicare for some reason decides that they don't want to cover it, and you have a supplement that's going to offer another 365 days for $1.50 or whatever it is. It kind of depends on the company, but it's really, those riders are really, really inexpensive. Difference between a Medicare replacement, so that'd be like an Advantage plan, Medicare replacement versus a supplement. You're welcome. How much do deductibles vary between supplements and Advantage plans? Advantage plans, again, because you're starting at a potentially little to no premium, or you could potentially have $100 in premium, but you could have out-of-pocket expenses on Advantage plans that are pushing $7,500, $10,000. It all depends. Now, there are some that are at $3,500. So there's lots of different plans out there. More often than not, deductibles for supplements are going to be less than that. And that's if you choose like a high deductible plan. If you decide to have a higher premium, then you're going to have less out of pocket along the way if you go the supplemental route. Let's see. I think that was the last one. And we're a couple minutes over, so as long as there aren't any others, again, I want to thank you very much. I really hope that you found this helpful. And certainly, again, reach out with any questions. I would love the opportunity to talk with you and help you out and make sure that we follow all the rules and get you what you need. So thank you so much. Have a great evening.
Thanks, Ben.
My
Have a
pleasure.
good night, everyone.